Hey, what's going on, everybody? It's the Trading Chief, and today I want to bring you a small cap biotherapeutics company based out of Israel with an upcoming biologics license application that's currently sitting with the FDA, and they're looking at results on May 9th. But first, I want to show you. I recently learned that 67% of the people viewing my videos are not subscribed to the channel, so if you will, if you're not subscribed and don't plan on subscribing, please leave me a comment down in the section and let me know why, because I'm giving you a lot of good information. And if you've already subscribed, smash that like button. Help me out. And then come join us in the Discord and ask me some questions. All right. The company that I want to look at today is ticker PLX, which you can see right here. It finished in the after hours at $2.06. And here's the chart on it. You can see right here, $2.06, and that is Protalix Biotherapeutics. And let's take a look at what they had in the news articles that I found. And the first news article I want to look at was 12/4/2022. Shoot, which one was it? Open Leader Webinar. I think it was this one. Let's look at this one. Where you at? Protalix Therapeutics and Chisi. That is how you say it. I actually looked at it, had Google pronounce it for me. It's Chisi. It's an Italian-based company. So Chisi Global Rare Diseases, a unit of the Chisi Group, said the U.S. Food and Drug Administration has accepted the resubmitted biologics license application. Resubmitted sometimes I raises red flags to me. But generally, what I've found is when they decline a biologics license application, it's because the FDA wants more information from the company, and then when the company has to resubmit, they have to go back and get new data, which generally, well, in this case, phase 3 was a 2 year phase where they had to sign up and get everybody in there. It's 140 patients, and then they had to run all these tests on them for 2 years. Um, so you can see how that would take a long time. And I was gonna look, but after realizing that, I'm not scrolling through news articles all the way back to 2018. Somebody with more time can do that. Let me know in the comments if you find that. But I highly doubt anybody's going to do it. Um, the company said its resubmission includes a comprehensive set of clinical and manufacturing data, which is compiled from the studies that involved more than 140 Fabry disease patients with up to 5 years of follow up. If approved, Protalix will be eligible to receive a milestone payment from. Oh, look at that! So if it's approved, they'll also get there's another catalyst right there for the company, a milestone payment from Chisi Group. So there's that. And then the next news article I wanted to look at was on 4/4/2022. Shoot, there's a bunch of them. Which one did I want to look at? I think it was this one. Protalix. This one's long. So this is the one. I'm not going to read all of this. You can come read it yourself. But it's Protalix, a biopharmaceutical company focused on the development, production, of commercialization of recombinant therapeutic proteins produced by its proprietary ProCell plant cell-based protein um, expression system and Chisi Global Rare Diseases, a business unit of Chisi Pharmaceuticals or Pharmaceuticals. I don't know. That sounds Italian. I don't know if this whoever the author was, I don't think they messed this up. I think this is Italian. An international research-focused healthcare group today announced top-line results from the balanced pivotal phase 3 clinical trial evaluating Paguna galactosidase alpha PRX 102. That's what we're going to call it. 1 milligram per kilogram of weight. So that it's 1 milligram of the drug for every kilogram of weight. That's a lot. Every administered every 2 weeks, compared to the galactosidase beta or Fabrizum, which is a drug owned by Sophie, um, for the treatment of Fabry disease. So this drug will be, um, what's the word I'm looking for? An opponent, I guess. I don't. I'm drawing a blank. Anyway, whatever. PRX 102 is a novel pegylated enzyme replacement therapy (RT) under the development of the treatment of Fabry disease. The pivotal phase 3 balanced clinical trial has been completed and top line results of the final analysis are now available. This is a 24-month, 2 years, randomized double-blind active control study of PRX 102 in adult Fabry patients with deteriorating renal functions that was designed to evaluate the safety and efficacy of 1 milligram per kilogram of PRX 102 administered every 2 weeks compared to the galactosidase beta. The study enrolled 78 patients who were previously treated with the beta for at least 1 year with the estimated glomerular filtration rate, whatever medical terms. Patients were randomized on a 2-to-1 ratio for switching to PRX 102 and continuing to beta. A total of 77 patients were treated, 52 with PRX 102 and 25 with beta. So what that said is that they had 78 patients who were previously treated with the beta, and then they for at least 1 year, and then they swapped them over to alpha so they can intermingle with the two. So that's cool. A lot of stuff that we don't care about. 47 patients in the PRX 102 arm experienced at least one adverse event compared to 24 in the Galaxy arm. Sounds bad. The number of events adjusted to 100 years of exposure is 572, 36 events to PRX 102 arm, and 816 events in the beta. What? Okay, so those are significantly different. Why is it? I wonder how they got that data. Like, how are you gonna say that it's more here than here? More here compared to 24. Oh, okay. I see. It's percentage based. No, right? I don't know. They had more people enrolled in the PRX than they did in the beta. So percentage wise, 96% had reactions compared to the 90% here. So I guess that's why it's higher over 100 year exposure. I don't know. I don't even know if that shit matters. Uh, Considering that in the trial, patients in the PRX 102 arm were exposed to the first arm of the novel enzyme control, data appear favorable to PRX 102 and in line with what was observed in the previous clinical studies of PRX 102. this is cool. Of the patients that completed the trial, 69 have opted, with the advice of the treating physician, to continue receiving PRX 102 1 milligram per kilogram every other week in a long term open label extension study. So even though the trial is done, 69 of the 140 people have opted to continue taking this. So that's cool. And then I wanted to point out this: out of the 78 randomized patients, 6 patients discontinued the study out of the 5 from the PRX 102 arm and 1 from the beta. 2 discontinued due to personal reasons, 2 due to adverse events, 1 due to an unrelated adverse event, and 1 due to treatment-related adverse events. And there were no deaths in any of this, so that's good. So really, there was only 1 patient that had an adverse event that they stopped it. So there's that. But as always, I want to go look at their website and just show you their pipeline. They don't have a whole lot in it. I did read an article that this will be going the here's the drug we're looking at, 102. It's in marketing applications, as you can see. But I read an article somewhere in the news section there stating that PRX 115 will be going into phase 1 in the second half of 2023. So there's a little catalyst coming up for that. So I do not recommend holding this long term. I will probably only do a small position in this maybe a week before March 9th. But when I looked at their financials were terrible. They're like, I mean, for $115 million market cap, they've got like $28 million in debt. So there's that. Hopefully this gets approved and helps their debt out. But anyway, appreciate you watching. Hope you find this useful. Hope we make some money in the stock market together. Like I said, come find me in the Banking with Billy Discord and ask me some questions. One more thing. Just want to show you this. Shoot, where was that? Shares jumped 73% after positive trial results for PRX 102. So now you know why I'm interested in this one. After I told you their financials were a big pile of stinking manure. So 73% PRX 102. So there's that. That's the reason why. All right, appreciate you watching. Have a good night.